My name is Ashley O'Kane and I'm a PhD student at the UCL Interaction Center. My research has been funded by the EPSRC ICT project. I've been studying how mobile medical devices are really used in the wild. So, what are mobile medical devices? They're devices used for the self-management of a medical condition and have to be carried on the person. Mobile medical devices are being increasingly relied on as care moves out of clinical settings, particularly for chronic conditions such as type 1 diabetes. People who have type 1 diabetes adopt and use a variety of devices, including blood glucose monitors, insulin pumps, continuous glucose monitors, mobile apps, and newer devices are being introduced on the market. These mobile devices are being brought with people for self-care purposes throughout their day, every day, and they really are being used every day, whether it's at work, in the car, or even in the bar. However, this real-world use is hard to capture for medical device manufacturers, so I have employed a number of situated studies in London, LA, and Toronto. I used contextual interviews, a diary study, and observed a tech meetup to see how people really use diabetes technologies in their everyday lives, and it turns out their everyday lives influence its use. Infrastructure and physical context influence its use, such as lighting, making the device unbreathable, cold weather causing error messages, or nowhere to put them in the gym. Cultural context also influences use, such as bringing extra devices on holiday, not using them on dodgy streets in London, or using them on top of tables in bars, but under tables in restaurants. Social context can also influence use, such as not using them on a first date, hiding them from clients at trade shows, or not using them during job interviews. My research shows that despite health concerns, adults choose when, where, and how to perform self-care based on context and user experience. Everyday life influences how mobile medical devices are adopted, carried, and used. Using situated studies can uncover real-world use, non-use, and misuse to influence the design of these future devices. And I've been engaging with industry partners in the UK and beyond to implement these studies more broadly, showing the impact of this contribution. I'm also engaging with a number of clinical, charity, and industry partners on my next project, examining how DIY hacker technologies can be further disseminated to non-hackers safely, and this work is supported by an EPSRC doctoral prize that will start in October 2015 at UCL. My research shows the influence that user experience and context can have on the use of personal health technologies despite health concerns, through using situated studies to examine how mobile medical devices are really used in the wild.